Welcome to VNA Health Highlights, a program of the Visiting Nurse Association of Cape Cod. I'm Jeanne Sarnosky, and on today's program, we're going to find out more information about Caregiver Homes. And we're lucky today to have with us the branch manager for Caregiver Homes, Saran Craig.
Hello, Jeanne.
Thank you for being here and taking the time. I appreciate it.
Thank you for having me.
I always like to start with the audience getting to know you a little bit better. So how long have you been with Caregiver Homes?
I've been with Caregiver Homes just over a year now.
Oh, okay. And how about on the Cape?
I have been working in senior care for 10 years, on and off Cape. My first job on Cape was with Harbor Point, and I was working with the Alzheimer's and Dementia program.
All right.
After that, I went up to Plymouth Crossings, and I've been working in assisted living with Alzheimer's and dementia families and consumers for the past 5 years.
Wow,
Yeah.
that's kind of a special gift that you have. What inspired you to get into that?
Yeah. My grandfather, when I was a teenager, was diagnosed with frontal lobe dementia.
Okay.
And my family banded together to try to maintain his care at home as long as we possibly could.
Wow.
Which was for several years before we did have to place him. And my grandmother developed Alzheimer's a while after that, and we cared for her at home at my cousin's house for a good long time. So we have plenty of experience with Alzheimer's and dementia.
Right.
But it can be a very enlightening journey if somebody is there to guide you along, and I've very much enjoyed being able to help families along that journey and make the best of it.
Oh, wow, that's good for you. That is that's a popular role these days for families and for facilities, right?
It is. There's a lot of dementia, and people really want to care at home for their loved ones as long as they possibly can. Sometimes we can do that right up till the last breath. Sometimes we need to call on our partners in facilities to help with end of life and complicated care, but families want to keep families at home.
Yeah, right. So Caregiver Homes is a organization that's been around for a little while? It
has. Caregiver Homes has been around since 2007. We are a provider of adult foster care, which has been around for a long time. In 2007, regulations shifted a little bit, and the state is now approving that family caregivers can receive this benefit for caring for other family members.
Okay.
And that really opened the floodgates to being able to provide assistance to thousands of caregivers across the state.
So when you say adult foster care, just for viewers, if you could explain that a little bit.
Adult foster care is a program that pays a financial stipend, a tax-free, non-reportable stipend to a caregiver who has dedicated their time to providing care to somebody with a disability. We serve individuals 16 years of age and older with all types of disabilities. The caregiver lives with the consumer 24 hours a day, 7 days a week, and has signed on to be that primary caregiver.
So in your very own example of how you became interested in caring for your own grandparents, would you have qualified?
We would have. I think of my cousin who cared for my grandmother, and she would have been an ideal candidate for this program had it been around. My grandmother lived in her home. My cousin had to quit her job to stay home and be there to supervise my grandmother and to help her through the disease process, and was responsible for the hands-on care and for making sure that Gram was taken care of and as long as she possibly could until we did have to place her subsequently. But she would have been an ideal candidate for the Caregiver Homes program.
A good example, yeah.
Absolutely.
So what are the requirements for someone that would use this service?
Sure. Well, the consumer, again, 16 years of age and older with some type of disability that makes it so that they need help. The activities of daily living we look at, do they need help bathing, toileting, getting in and out of bed, walking around the house, getting dressed? So if somebody needs help with one of those, that's a qualifier. The caregiver cannot be a spouse or a legal guardian.
Oh, wow.
We haven't gotten that far yet with the state, but we're working on it. But any other relationship qualifies as a caregiver. The caregiver has to commit to being with that individual. The individual can't be alone for more than 3 hours a day. We can help troubleshoot with adult day health programs and such. And the consumer has to be Mass Health eligible. So they don't have to be on Mass Health. We can help them through that process, but it is a Mass Health funded program. So there are certain financial eligibility requirements.
Okay. And would they be receiving services from other agencies at the same time, and that's okay? Or?
We receive most of our referrals from agencies who are in providing support or case management or care. Where we are a Medicaid funded program, we can be in the home at the same time as VNA.
Okay.
As hospice, we have folks who are working with elder services, with the brain injury associations around Cape Cod. So we partner very, very well with the other service providers on Cape.
How well known is this?
It is not well known enough,
which is
actually,
so great
which
that
is why I'm here.
Yeah.
We currently have 117 consumers on Cape Cod. But when you think about how many caregivers are out there doing this work every single day, all alone, there are so many more that could qualify.
Right.
A lot of folks mistake us for home care, and we are not home care. We don't employ CNAs. We employ registered nurses who serve as case managers, and we employ case managers. And those are the individuals that are going into the homes monthly and providing support, education, training, care management to the caregivers and consumers.
Can there be more than one caregiver in the home?
Absolutely. We really try to help primary caregivers look into their circle and call on a sister or a brother or a neighbor or a church member who's offered their assistance. We credential the caregivers, so we do some background checking just to make sure our consumers are in good hands.
Okay. Even if it's a relative?
Absolutely. Yep. The state of Massachusetts requires that every caregiver has reference checks done.
Okay.
Just to make sure that everything's on the up and up, which is good because these are very disabled individuals, very at-risk individuals who we're really providing the care to.
Okay.
We also assess the homes to make sure the home is a safe environment, and we'll frequently refer out if there's a ramp that needs to be built or if a shower chair would help. So we make sure the home is safe.
Is the home a home house? Or
it is a home,
could be an apartment,
a house. We're in subsidized housing. Okay. We're in cottages on the beach. We're all over in all sorts of home settings.
Okay.
Yes.
Okay.
Yes, so we go in and we credential as many caregivers in that family situation as we can. There's something called alternate caregiver days that are built in. So if I'm the primary caregiver and I'm doing this 24-hour-a-day, 7-day-a-week work, but I need a break, maybe sister will come and stay with mom while I take a vacation. And in those situations, sister and I are both going to get paid for those days of care, and I'm going to know that sister knows what the plan of care is for mom and what mom's care needs are, and that she's been trained by a registered nurse who's come in and shown how to use proper body mechanics and what are the signs and symptoms of a UTI and who do I call if mom falls.
And this is a nurse from Caregiver Homes? From
Caregiver Homes, yep. And we are fortunately a program that can stay in for the long haul. So sometimes VNA comes in and does a wonderful job getting mom all fixed up.
Right.
But then VNA has to leave. We are able to stay in place as long as everybody qualifies for the program.
Wow.
So we have consumers who've been on for 5 years, going strong, and they could be on for another 5. So we're going to be there through the good, through the bad, through the falls, through the med questions, through all of those hiccups along the way of caregiving.
So the caregivers that are in the home with the consumer then have someone to call, someone to go to with any questions. You have a help desk or
Absolutely. Most of our caregivers are not trained caregivers.
Right.
You know, this is like my cousin who was in banking and she took on my grandmother with Alzheimer's care. So our nurse and care manager are there for the phone calls. If mom falls, they can call that RN with Caregiver Homes and ask, what do you think I should do? And we can triage over the phone. Or they might call and say, I'm getting really burnt out, and we'll help them get into an adult day health program. There's also a daily note that our caregivers enter, so that every single day they're entering a note online. It's a very simple note, and so our teams are reading that daily. So we know every single day what's going on in that home. And if we read mom had a fall, we'll give them a call the next day and say, I read that mom had a fall, just want to check in, see how everything's going. If a caregiver's never used the computer before and doesn't have one, that's fine. We will get them a computer, we will teach them how to use it, and we will walk them through that process. But that day-to-day touch is very, very important, because it's not just the once-a-month visit. We're committed to this as a team 365 days a year, right along with that caregiver.
Wow.
Yeah.
But above and beyond a call for need, or you recognize a note that came in on the computer, it's a once-a-month visit.
It is a once-a-month visit.
See how things are going?
Absolutely. And some of our visits, the caregiver just needs to vent. We have a caregiver who, her grandson had a horrible car accident 20 years ago and has a traumatic brain injury, and they care for him in the home. And we go in once a month, and we're somebody that will listen to that story over and over and over. And if she's tired and frustrated, we never judge. She can tell us she's tired and frustrated. It's a safe place to turn to. As a caregiver, you can feel very alone when you're in the home with your loved one. And there are a lot of emotions that go along with caregiving, and they're natural, but sometimes caregivers feel guilty about that. So when our team walks through your door once a month, you can laugh, you can cry, you can vent, you can scream if you want, but we're there to help you look around Cape Cod at the different services that are out there and help you find them and help you navigate that and make referrals to outside programs that will help make your job easier.
So what is the caregiver's responsibility? To be there? Is it just to be there, or are they?
We have a plan of care that we develop with the caregiver. It's usually what the caregiver's already been doing, but we want to look at, how often is mom being showered, and how are you doing that, and how often is she being hydrated? Is she getting enough to drink? So the caregiver is responsible for providing excellent care. They're also responsible to communicate to us if anything happens. The state of Massachusetts, through this Mass Health program, is counting on us as an agency to ensure that these consumers are still safe in the community. And so we take that job very seriously, and we want to know if something's gone wrong, so that we can help to make it right for the next time.
So this ultimately keeps people out of a skilled nursing facility.
It's really the state's answer to people being institutionalized before they really have to. And on a great note for Massachusetts, it's saving a ton of money, because there is a time and a place for a nursing home. But all too often, people are placed there too early, when there is somebody willing to provide care to them if they just had a little help. And we are that help. And it adds quality to people's lives, because your mom can go to an adult day health program, or your son can go take classes at the May Institute and give you a break, or we can call in hospice and have them there to help you through this difficult end-of-life experience. So it does help keep people at home in the community longer, and that's where we all want to be.
That's where we all want to be. Safer, you're with your own people. Healthier because you're in your own environment.
One-on-one care. Who provides better care than somebody that already loves us and knows us and wants the best for us?
So are the caregivers always not working, or?
We have some caregivers who have jobs.
Work out of the home?
Absolutely. Again, the consumer can't be alone for more than 3 hours a day, but if somebody wants to work, we'll help that consumer find a day program. Or maybe there is somebody who'll come sit with mom for a few hours a day while I go to work. So again, it's trying to pull in all of the resources a caregiver has. I always say to a caregiver, never say no to help. And we're able to bring in resources they might not know about. We have consumers with traumatic brain injuries, and we go into one home and learn about a program and go into the next home and share that with another family. We have families that have AIDS in their family, and we learn about resources from sister caring for sister with AIDS, and we pass it on to partner caring for partner with AIDS. So it's very much an information and referral and resource sharing program.
Is it Cape-wide?
It's actually statewide. So Caregiver Homes is the largest provider of adult foster care in the state. We have nearly 2,000 consumers right now as of today, from the Berkshires to Provincetown, Martha's Vineyard. So we are a statewide program.
Wow. How many on the Cape?
We have 117 as of today. We have several more who are in the process of application. But this is a program where sky is the limit. If we had 300 consumers on Cape Cod, we could care for 300 consumers on Cape Cod. I would just have to hire more nurses and care managers.
So as a business model and for the state Medicaid program, it's still more reasonable to have a program like this rather than institutionalize someone.
Absolutely, absolutely. And that stipend is not a ton of money, but it allows somebody to be able to stay home with the person that they're caring for. And that non-reportable income that they receive from our program, they can still be qualified for other forms of assistance because it is a non-reportable stipend. It's a tax-free stipend. And they can use it for anything. We don't track it. We have a son who provides care for his elderly mother. He's uncomfortable showering her. So he can use that money and turn around and pay an agency to come shower mom. They can buy oil with that money. They can go on a vacation if they want with that money.
Right.
That's for them and their use, whatever they need to do with it.
Because of the time.
Absolutely, they're putting in their time and everything. Yep.
Right, right. Now, frail elder waiver.
Yes.
You had mentioned that. I just want to follow up with
yes, the frail elder waiver. A lot of folks think that the Medicaid is very difficult to get on, and standard Medicaid, your income is around $963 a month. For frail elders, people 60 and older, they can have an income of up to $2,100 a month. They can own their own home if they live in their own home. And it really opens up that individuals who are older with frailties can stay in their home and still be on Mass Health.
Okay.
So again, this is where we can help people through this process. We always say, you know what, call the intake line. See if you might qualify. We work very closely with Sheila Curtis, who's fantastic, who I told my team I was going to throw her under the bus today. She knows all about Mass Health, the frail elder waiver. She can help people through that process if they have questions.
Okay.
And again, it's working closely with our Cape Cod partners to get the most we possibly can for our Cape Cod consumers.
So who do you now receive referrals from? Do you get calls from families, from end users, or do you mostly are getting through the agencies like the VNA?
We receive a lot of referrals from the VNA, from hospice, from the disability groups on Cape Cod. A lot of word of mouth also, families referring other families, which is wonderful because they know fellow caregivers and they love our program. But really we're trying to get the word out through our agency partners because they're in the homes and they see the people providing care and they know what we can do.
Physician offices?
We work with physician offices, absolutely, because we communicate every 6 months with the doctor's offices.
Oh, okay.
So we send them a semi-annual status to say this is how your consumer's doing at their home. This is what we have for the medications right now. This is the plan of care. And so we're communicating and keeping them up to date on what's going on with their patients. So they're fond of our program as well.
I would guess so,
yes.
Definitely.
Yes.
Now, are there other programs like yours out there? How are you different than some of the other?
There are between 60 and 70 adult foster care programs in the state. What I like about Caregiver Homes is that this is all we do. Adult foster care is our focus. We have the technology piece of the daily notes, which makes us different. The state standard is that a form is filled out, and at the end of the month, your team picks it up when they're at your house. But you might not remember every single thing that happened through the month. Right. And you might not think to call when mom has her fall. So the daily note that we have makes us different in that we have that daily touch. We also do things with risk management. We have a fall risk worksheet. You know, we run into risk every day. Getting out of bed is a risk. You never know what's going to happen. So we look at our cases one by one and say, is there an increased fall risk? You know, does mom look a little more unsteady? Is she on a medication that might cause her to fall? So we're thinking ahead of the fall. If we believe they might be at an increased fall risk, we're going to call in physical therapy to avoid that fall. If we see the caregiver is getting a little bit burnt out, we see that as a risk. What are we going to do to help caregiver maintain? We have new tablets that we bring into the home, and we do that risk assessment every single month, first thing when we get there, to say, oh, I see that your fall risk has increased. Let's talk about what we can do so that you don't have that fall that puts you into the emergency room. Let's see what we can do to avoid your caregiver burnout risk. How can we get you to a support group? Right. Can we get mom into adult day health to get you a break? And I say mom because most of our folks are caring for an aging parent.
That's a good example. We'll stay with it.
We have partners caring for partners. We have siblings caring for each other. We have parents caring for adult children with disabilities, autism, traumatic brain injury, mental health. We have so many different situations out there. But in every home, there are different risks. And when we go in, we're trying to see what might be a hurdle to this situation, and how do we jump over that hurdle rather than running right into it.
So as part of the daily note, for example, it brings to mind the falls risk.
Yes.
So if there was a medication change, is that up to the caregiver then say, hey, mom went to the doctor, they're given new meds and it has some of these risks, it's their responsibility to get to you?
They let us know the new medications. And quite frequently when we get to the home visit, the nurse will say, let's get out that bucket of medications you're on, and we'll look at them. And we have a wonderful med list that we print up for our consumers and caregivers with all of the medications they're on, as well as what the risks are associated with each one of those medications. And they have that printout to bring to the doctor, to bring to the hospital. But we get a little red exclamation point on certain medications that lead to an increased fall risk. Because a lot of times caregivers don't know, and they're so busy. And God love the doctor's offices that are so busy. We're that extra check to make sure that caregivers are aware of everything that comes along with those medications. So
we have a family member in, and it's okay to have, I'm just rehashing some of there's so much information. So it's okay to have somebody else involved.
Absolutely, we encourage it.
So that would be an alternate person?
That would be an alternate caregiver.
Not necessarily one that lives in the same home, or do they have to?
Not necessarily, no. And where we're statewide, we can credential homes and caregivers all over the state. So maybe you have your brother coming to Cape Cod to stay with mom in the house while you go on vacation, or maybe you have mom going to stay with brother in the Berkshires for a couple weeks while you're on vacation. And again, being a statewide provider, we can credential those home settings and make sure they're safe. We can go train and educate you and your brother. And I think that education piece is a very large part of it. People are not trained on proper body mechanics. People are not trained on signs and symptoms of a urinary tract infection. So this is where we're able to train the primary caregiver, the alternate caregivers, whoever in the home is going to be helping this person.
So are they also in doing safety checks, scatter rugs, grab bars, helping them line them up with all that? And
there are times where before we even bring somebody onto our services, we're calling VNA for physical therapy, occupational therapy consult. Maybe we say we can't credential this as a safe home until there are bars in the bathroom, or until there's a ramp out front. Let's call VNA in and see what else they see. And then we're going to refer you to an agency that can provide you with those ramps and bars. So we're really making it a safe home environment for the consumer.
And you coordinate with so many others.
We work with so many. We're very much a case management agency. We know who's out there. We know who can help. And sometimes when you give someone a business card and say, here, give a call to Cape Cod VNA, they say, I will later, and they lose the card. We can sit there and say, why don't we call them together right now? Why don't we get them on the phone? And then Cape Cod VNA also has our information. So they can call us and say, we're going to be leaving the house, but we really think that this physical therapy regimen should be continued. And when we go in for a monthly home visit, we can say, how you doing with that physical therapy?
And they know.
And they know. And it's a big team partnership. And this is what I was missing when we were trying to care for my grandmother and my grandfather. We felt so alone. And caregivers don't have to do this alone.
Wow.
It's a great program.
It is a great program.
Very passionate about it. And I didn't know about it until I got the job. And I think of all of the people that I could have referred, that I could have helped, and I just didn't know.
And how great for you to have had really the firsthand experience of what those needs are. So you can honestly say to the people that you're bringing on as clients, I know exactly what you're going through. This would be such a big help. These pieces that I can refer you to.
And our team of registered nurses and care managers, they've all been caregivers or had caregiving in their lives. Of different, we have a wonderful woman who knows in and out developmental disabilities because of family experience. We have a care manager now whose mom is end stage and she's walking that path. So they know how it is. And when a caregiver just needs to cry, we're there to just let them cry because we know how hard it can be. Or if they say, you know what, I don't have time, I need some help, you know, we're right on the button because every caregiver is different. Every consumer is different.
So I need 3 hours of respite, or I need half a day to do, you make it happen.
We make it happen because we know we've been in their shoes.
So believe it or not, we only have a few minutes left. I just want to be sure that, is there anything that we haven't talked about that you want viewers to know?
Oh my goodness.
We've covered so much. So was it the age group, 18 and above?
I think the biggest thing, 16 and older.
16 and older.
I mean, if you are a caregiver, if you know a caregiver, you know, don't worry about whether or not you would qualify. go to caregiverhomes.com and apply online. Call us. It's a free service. You're not paying anything. We're paying you to do what you've been doing all along. And not only are we paying you, but we're going to hold your hand and we're going to walk this path with you. And we're going to make sure you can get all of the help that's out there.
Wow.
All disabilities. We have autism, developmental disabilities, traumatic brain injuries, Parkinson's, Alzheimer's. Any disability can qualify.
Wow.
And all it needs to be is cueing and supervision with one activity of daily living a day, and you qualify. So it is a great program. It's very broad.
Yep.
And again, sky's the limit, and we will stay in there for the long haul. And when it comes time, maybe it's gotten too hard, maybe the Alzheimer's has gotten a little too much, we're going to help you with that discharge plan. We're going to help you find a safe place for your loved one to move on to.
Yes.
So that you can rest at ease knowing that you've done all you could possibly do, and that now loved one is in a safe place for the rest of their life.
And they can call you?
They can call us. They can go online, caregiverhomes.com. Or actually, the best phone number to call is our central intake line, and it's a statewide number.
Okay.
It is 866-797-2333, or again, caregiverhomes.com.
Great. Thank you, Sarah. That's great information. I appreciate your time today.
I appreciate you having me.
All right. I'm Jeanne Sarnosky, wishing you good health and good health care.